Good afternoon, everybody. I'm Steve DeMello. I'm the Director of Healthcare here at CITRIS, and I'd like to welcome you all to our lecture today. Also like to welcome the folks who are our web viewers from the other CITRIS campuses. A couple of quick reminders. First, as you may know, we have an energy lecture series called I for Energy, which is each Friday at noon, also here, and excellent speaker this Friday. In addition to that, if you're interested in round 3 of the Jeopardy competition with IBM's Watson, we're having a viewing party tonight. There'll be food and reception starting at 5:30. We'll have an actual screening here, and we'll have commentary from Horst Simon from LBNL and Dean Shankar Sastry from the College of Engineering. If you're still interested in the Big Ideas competition, remember that the deadline is March 7th for submitting an application. And there's information at the back of the room. And a final reminder that everything you've got today, with the exception of the aluminum wrap and the plastic bottles and cookie bags, can be put in the composting center, which is at the back of the room as you're leaving the door. It's my great pleasure today to introduce Dr. Gladys Block as our speaker. Dr. Block joined the faculty of the School of Public Health in 1991 and was chair of the Public Health Nutrition Program until her retirement in 2008. She obtained her PhD in epidemiology from Johns Hopkins and was a researcher at the National Cancer Institute before joining us here at Berkeley. Her continuing research work emphasizes 2 themes. The first is the role of oxidation and antioxidants in health and disease. The second, which is the focus of her talk today, is translational work to make the results of nutrition research directly available to consumers. As part of that, she will talk specifically about Alive, an online, evidence-based health and fitness coaching program. Please join me in welcoming Dr. Gladys Block.
Thank you, Steve. It's a pleasure to be here, and thank you all for coming, and thank everyone online who is watching. I'm going to tell you today, as Steve said, about the Alive program. As you can see, there actually is an acronym underlying it, a lifestyle intervention via email, but we don't emphasize that really. This says developed by, and my name is first only because I'm giving this talk. It was by no means developed by me. It was developed by Nutrition Quest, which is our family business. We have behavioral and nutrition expertise, and in collaboration with other eminent scientists, particularly at Kaiser Permanente, but also with Brown and Stanford. So I'm just going to tell you very briefly, give you some background. I'll tell you a little bit about the results of the previous trial of Alive, and then I'll tell you in more detail about how Alive itself works, and then the current UC program. I left some flyers on the table about the current UC Alive program and randomized trial. So just as an overview, Alive is an email-delivered program to help people develop and maintain, that's critical obviously, improved physical and dietary habits. There are lots of programs out there, but the point is we need to change people's habits. We need people to develop habits so that they don't have to be working at it so much. And it's primarily through goal setting. It's been proven, as I said, proven effective in a randomized trial. And it is not a weight loss program. If weight loss is important to people, we give them a little support. But our philosophy is it's not a weight loss program. It's a diet and physical activity behavior change program. So background, you all know this. You've all heard this. We have a high prevalence of not enough fruits and vegetables, too much saturated in trans fats, not enough physical activity. Americans are not doing well in any of those areas. And this, according to CDC, diet and physical activity are 2 of the top 3 causes of chronic disease, which are in turn the top causes of our healthcare costs. So we need to do something. We need to do it widely, and we need to do it inexpensively. So that's what Alive was developed to serve. Alive uses behavior change principles and a wide reach technology. And you know, these days, it's, as Steve was saying earlier, only in the past few years has it become possible to reach essentially everybody for relatively low cost. So we, through a CDC grant, we developed the initial Alive program and conducted a randomized trial in a workplace. And I'm going to tell you a bit about that in a minute. Our current funding is from NIH, and it's to add features, which I'll tell you about later, and test it in an older working population. So the NIH grant is through the Aging Institute. Aging specifically wants to get people to change their diet and physical activity behaviors before they retire, partly because that's obviously good for their health, and partly because we need to get them to change their behaviors before they hit the Medicare system. And so we're funded to develop and do a trial on a program that will be effective for working people age 50 and over. So let me tell you a bit about the previous trial, and the reason I'm doing this is to tell you that there is evidence of effectiveness. There's a rigorously analyzed, randomized controlled trial, which in this business is very rare. There's a lot of stuff out there. Very little of it has been subjected to a randomized trial, and still little and still less, and maybe zero, has it been done in a really rigorous analytic method. So this was a largish trial, 800 people. It was a 4-month intervention. This was an average, sort of a typical working population, overweight, middle-aged. Our analysis was, does the change in intervention exceed the change in control? And it was an intention to treat analysis. So what, if you don't know what that means, it's sort of the gold standard for analyzing randomized trials. And it means you include in the analysis everybody you started out with. And if 1/3 of them didn't respond to your intervention, too bad. They still have to be in there in the analysis, and you analyze it as if they had no change. And despite that really very rigorous analytic method, we still found statistically significant effects. So we had significant improvements in physical activity. These are p-values which indicate statistical significance. Usually the usual level of statistical significance is p less than 0.05. So you can see these are all very statistically significant improvements in moderate activity, in fruit and vegetable intake, in saturated fat intake, and indeed even in quality of life. So we had measures before and after of a standard short form SF8 version analysis of quality of life, and we had statistically significant effects. And these were non-trivial effects. It was these results that got us the current randomized trial, because among people at 50 and older who needed the intervention, they increased non-trivially. I mean, 45 minutes a week is a substantial increase, as well as significant and non-trivial decreases in saturated fat and trans fats. And as I said, they had significant improvements in quality of life. So why would that be? Well, partly because there is actual considerable evidence out there that nutrition and physical activity improve your quality of life, improve your feeling of vigor, improve your mood. And so that's, it could be physiological, actually. But in addition, we think that there is something probably going on with regard to self-confidence in their ability to make changes. The goals we give them are easily achievable. I'll show you some of that, but they are the kind of thing that you can do and you can build it up. I will walk around the block at lunchtime 2 days this week. I mean, the goals we give them are goals that are achievable at their level. And most amazingly, to us as well as everyone else, is that the statistically significant effects lasted for 4 months. So we did a baseline, and then we did questionnaires at the conclusion of the intervention at 4 months. And then we went 4 months without contacting them in any way. And then we repeated the same questionnaires, and those improvements in diet and physical activity persisted after 4 months of no intervention. So we've published a couple of papers on this. I left a couple on the back table. I know there were only a couple. I have a couple with me that anyone can look at if you want, or you can email me. As you see, my email address is at the bottom there if you want me to send you copies. So Barbara Sternfeld is an expert in physical activity, and she was our collaborator, our chief collaborator in the development of Alive. She's at Kaiser. Clifford Block is the second author here. He's my husband, and he is a behavioral science, behavioral psychologist with a whole career of using technology to make wide-scale changes in behaviors, both educational behaviors and health behaviors. And so this is the paper that actually talks about the main results of the trial, improving diet and physical activity. And this paper talks about the development of the program, gives considerably more detail about what goes into it. So if you need copies, want copies, you can email me for that. Okay, so now let me tell you in a little more detail about Alive itself, about the program. So it's an email-delivered program to help people increase their physical activity, decrease saturated and trans fats, decrease added sugars, real problem in our society today, and increase good fats and carbs. So we want them to increase omega-3s, and we want them to increase monounsaturated fats, and we want them to increase whole grains. So each of these 3 topics is a 12-week program, and so they can cover all 3 of those 3 topics over the course of about a year. Or if they prefer, they can stay in one topic for the whole time. There continue to be goals and so on. But if they want to change, they can cover all 3 in a year. And it's tailored these days. That's the key word. It has to be tailored to the individual. We have lots of health promotion, public service announcements and that sort of thing. And I'm all for them. But people don't hear them too well unless they can see the relevance to themselves, and they don't know how to change unless you give them assistance that's relevant for their own particular situation. So tailored intervention, and there are web components for interaction and support, and I'm going to show you some of those in more detail. So this is, as I said, based on behavior change principles. My husband's a behavioral psychologist, and these are not exclusive to him. These are the principles that are governing all behavior change research today, basically. So tailoring to the individual, and I'll tell you a little bit more about that, but it's to their diet habits and their exercise, what they would prefer to do, and lifestyle factors that influence what they can do. Goal setting is a long-established principle of behavior change. You help people to make goals and achieve their goals. Small steps is a key part of our program, moving them forward in the right direction. Our principle basically is I want to move them in the right direction. So I'm not necessarily trying to get everybody to 9 servings of fruits and vegetables a day. I'm trying to move them in the right direction, get them closer to where they should be. Feedback is obviously important. Increasing the salience and motivation. So it's not an information program, but we do provide information. And in large part because if you keep it in front, if you keep the fact that physical activity, increased physical activity reduces your chance of Alzheimer's, that increases the salience so that when they hear something in the news, that it will get in. They'll hear that. It will sort of resonate, and that information will support itself, you know, resonate in their mind. We do some social support. We have, you know, a Facebook site and so on. And relevance to the user, as I said, really important. So we start off with an assessment, and that gives them feedback about where they really are now. And the goals we give them are based on what they told us. So for an so we think of this, although this program is available for individuals, we think that organizations are the ones that logically should be buying this. So this is really simplicity. You set up an account, promote it to your organizational members, and we have some promotional materials we can offer. And then all the rest of it basically is done through our server and is done through programming, so that there's essentially no administrative burden on an organization. For an individual, I'm going to go through the Alive program and show you in some detail about how it looks like to an individual. So they'll either go to a website to sign up, and this is an example of the UC Alive website. I'll give you the web address for this in a little while. Or they can receive an invitational email through their organization's health promotion group. Then you take a baseline questionnaire and get the results. And only then do you decide whether or not to participate. So if you're already doing splendidly in all of these behaviors, they may choose not to participate. But it will show you, the results will show them where they're falling short. So making it relevant, showing them the need in their own lives. And then they start the program, which is based on weekly emails. So that's the website. So the first step is assessments, and they're both diet and physical activity. Everybody can take them, and everybody can get the feedback whether or not they decide to sign up. So this is a real benefit to many people. People have expressed to us how useful it was to them, and fairly quickly completed. I mean, it's not a 2-minute assessment, but it's in detail about their diet, their specific diet, the foods they eat and how often they eat them and what kind they eat, and their specific physical activities. So we tailor it to all kinds of things. We tailor it to the specific food. So if they tell us that they drink Cokes 5 days a week, full sugar Cokes, we will suggest that they cut down on Cokes. We won't suggest that to people who already are eating drinking Diet Cokes or drinking water or whatever. Do you have kids at home? Who does the cooking? These influence how you can change, what the real life constraints in your life are. So we tailor it around that. The activities you're willing to do, how close or far you are from the recommended level. So a lot of people who have signed up for this program are actually already doing very well in physical activity. They're already, in fact, meeting the guidelines, or at least they're close to it. And so for them, we want to move them on to, get up to 300 minutes a week if possible. But there are a lot of people who are couch potatoes, and we can't move them that fast, that far. And so we start out slow with the people who are far from the recommended level. And if they're interested in weight loss, we will give them some support. Of the goals we give them, maybe once a week, one of the 4 goals will be something to do with weight loss, but we're not pushing it. We're giving them support if that's what they want. If they said that's not that important to them, we don't give them any weight loss goals at all, because our main point is changing these behaviors, these diet and physical activity behaviors. So this is an example of the assessment questionnaire. So, how many days a week do you drink glasses of milk, and how many glasses on those days? And there's a later question that asks what kind of milk it is. Same for physical activity. It's quite detailed, and we can use this information not only to calculate grams of saturated fat, for example, but also to tailor what advice we give them. And so then they get feedback on this, on all of these 3 types of behaviors in relation to national recommendation. And here's an example of that. So for saturated fat, your saturated fat is very high, and it tells them a little bit about why that's not so good for you. Here are the top 3 sources of saturated fat in your diet, and these are actually based on their answers to that question. So cheese, ice cream, and chocolate candy are top sources of saturated fat in this person's diet. Even if they don't do the program, this is a benefit to them. They can see, okay, well, maybe I ought to cut down on these a little bit. So we have that for all of our outcomes. People really appreciated that, and these are some comments that we got from the first trial. It let me know about myself. It was an eye-opener. I realized I need to eat less sweets. I mean, these are, as I said, even if they don't do the program itself, this is already beneficial information to them. And so then at that point, they get an opportunity to enroll, and they give us their email. And then after they've given us their email, the program proceeds based on programming, obviously. So after they've decided they want to enroll, they choose one of these big goals to work on for the next 12 weeks. They can actually change their minds, but we encourage them to stay in one topic for 12 weeks because you need an extended, concentrated period of time to actually develop a habit. And that's what we want them to do, is develop a habit. So the heart of the program is weekly goal setting. So they get an email directly into their email inbox. And that contains 4 tailored goals to choose from. We tell them to choose 1 or 2 of these. There's a write your own goal, so if none of the 4 that we offer resonate with them, they can write their own goal. And they get a summary of this week's health notes. So this is an example of a weekly email. So how did you do last week? So last week you chose this one. This week I will eat half as many biscuits, so they can tell us whether or not they succeeded. And, oops. And then as you can see down here, there are 4 selected goals that they can choose, and there's also a write your own, which doesn't show on this screen. And then there's a brief summary of our weekly health notes. So every week there's a new topic relevant to one of those 3 paths that I mentioned. This one is the fats and carbs path. And so this happens to be early. We tell them about what the good and bad fats are. And this is a headliner that's on the email that they actually get. So even if they don't go further, they've gotten a little bit of salience, increasing the salience of the issues. But the important thing is choosing a goal takes you to your personal homepage. There have been a lot of studies of web-based diet and physical activity stuff. And in most cases, they find that people don't take the initiative to go to the website very often. And the way we've set it up, they choose a goal. If they choose a goal this week, they go to the website and then can interact with the other stuff that's on the website, on their own particular website. So there's no need for the participant to decide whether or not to visit the web page. It takes them there. And their homepage, it's an individual's homepage, contains tips for achieving that particular goal that they chose and lots of other interaction. And I'm going to go through some of that and show you. So the individual's homepage contains these various tabs, and I'm going to go through and show you a bit about them. There's a question of the week, which is relevant for the particular path they're in. This is physical activity, move more, sit less. And so there's a quiz that has some relevance to physical activity, and it gives them the answer right away. And of course, we tabulate that. And it's adding up the goals that people have selected throughout the program. So in the UC Alive program, we're up to something like 11,000 goals that the UC participants have selected so far over the program. So there are these tabs up here. So current goals, this one reminds you what you chose and then gives some tips for achieving the particular goal that you chose this week. And you can share your goals down here on Twitter and Facebook to perhaps build up some support for what you're trying to achieve. And then there's the Health Notes tab. There, as I said, there's an extensive health note. On the email, it's an abbreviated form. It hits the highlights of the health note. But on this tab, it's full length, it's extensive, and it gives them detailed information about, in this example, what the guidelines are and how much we should be doing. The Resource Center has, for example, tips for overcoming barriers that they specifically mentioned. So we asked them early on, what barriers have you encountered to changing this behavior, to changing physical activity, for example? I don't enjoy it, and I'm not interested, and I'm not motivated. That's true of a lot of us, I think. And so we try to give them some tips for handling those barriers. There's a Health Notes library where as they progress through the weeks or months, all of the health notes that have been presented to them, they can go back and look at them and remind themselves about it. There's a whole extensive useful links that's categorized by physical activity and a lot of specific disease information and more assessment tools. And then there's the simulator tools. So this is a thing that people like a lot and I think has been quite useful. So it shows the participants' actual responses. It's a tool which this is what it looks like. I'm going to come back and go through it in a minute. But it shows, it knows what the individual answered. And so it shows where the individual was in terms of diet and physical activity. And the individual can change the answers and see what would happen. So what if I ate hamburgers once a week instead of 5 times a week? What would that do to my saturated fat? What would that do to my calories? So it shows the effect of changes that they can make. So so this is where they were. You're not eating enough fruits and vegetables, only about 2.5 cups or pieces. The recommended level for you, it's age and sex specific, is 4.5 cups. And so here they were in the not recommended area. Now, and these are some fruits and vegetables that they said they ate a lot. So these are, or that they said they ate, because obviously they didn't eat a lot. So you were here. You said you ate salsa or cooked tomatoes a few days a month. They can drag this little cursor up to, let's say, 3 or 4 days a week. They can drag the portion size up to 1/2 cup or 1 cup. And as they drag that, this little cursor down here, you could be here, will move. Will show them how far they need to, how far that would move them toward their goal. And it can accumulate, so they can make a lot of different changes and see and basically develop a dietary pattern that will take them to where they need to be. So that's basically the ALIVE program that we tested in the randomized trial. We have recently, through this NIH grant, added some features, and one is tailored automated phone coaching. So every other week, and this is, you know, all computer generated. Well, the scheduling is all computer generated, and the scripts were written at in exhausting detail, in part by me. And they're tailored to where the individual is and what answers they give. So the phone might ask them, well, the phone will ask them, you know, how have they been doing? And the phone will ask them, well, I can't even think of any good examples right now. Here are some reasons why people have had problems in the past. Which one of these is true for you? The person responds either orally or by pushing the phone button, and then the program will select the appropriate answer. So there's lots of responses, you know, pre-written, pre-scripted, all kinds of branching, and then recorded by a voice talent. So that's the phone coaching, and there's also automated print materials, which are which come once a month, which are in the same path they're in. So if they're working on physical activity right then, it will be about physical activity. It will be different each month. It will use, you know, behavior change principles like, you know, write down why you think you want to be more physically active, or write down what has been a problem for you, and here are some ways that you can ask your friends or family to support you. Here are some recipes. So you know, there's monthly printed materials. So that's sort of where we are right now. It's ready for commercial or research use. So I think a lot of health researchers could be using this in conjunction with the projects they're working on. It will support people in day-to-day, week-to-week ways that many programs don't provide. We will hopefully, we believe that we will get another NIH grant depending on whether Congress cuts NIH's budget. We've gotten a good score and we expect to get it, but you know, we're still in a continuing resolution on the budget, so we don't know when that's going to happen. And it's currently being offered free to all UC staff and faculty, so I'll tell you a little bit more about that. We currently have 9 campuses who are participating in this. And so what we offer is the regular ALIVE program that I just went through and showed you for faculty and staff and their families under the age of 50. And then for people 50 and over, they get all of that. It's a randomized trial, so people will actually be randomized. I'll show you that in a minute. So anyone can participate. Anyone affiliated with UC and family, any unit of UC, retirees, etc. And I added this, actually anyone, because we need sample size for our randomized trials. So when I set it up, I set up having it ask which campus are you associated with. There's an other or none that people can choose if they're not actually associated with that. And so the way the randomization will work, they'll either get the regular ALIVE program I just showed you, or the regular ALIVE program plus the printed materials and the automated phone coaching, or there's a control group which gets monthly information on other wellness-related topics, social wellness and environmental health and that sort of thing. And then at the end, they will get the full program if they want it. So if you want to sign up to participate in this UC Alive program, that's the website you can go to. I think it's on the materials that I handed out. And you can sign up and you do the physical, you go to that website and do the baseline assessments and get the feedback, and then you decide whether you want to actually participate. So there's no commitment until you actually make the decision. If there's anybody whose group might be interested in the program for a group, contact the website. So, summary, Alive is based on widely accepted behavior change principles. It's been proven effective with a rigorous analytic method. It's low cost, low administrative burden, and hopefully, we hope it will make a difference in health and in healthcare costs. We'd welcome your suggestions about marketing Alive. I know that sounds silly, but we're great at developing and less good at marketing, promoting it. So any suggestions you have would definitely be welcome. If you want to make suggestions, you can visit our website there or contact me directly. I'd be happy to talk with you. And I think then that's it, and I will be happy to take questions.
Questions for Dr. Block? Right here.
Hello, doctor. Usually in this type of interventions, the biggest problems are engagement and attrition. Can you explain more the engagement process? Because you said you sent an email. Do you have an idea of those who received the email? How were they selected? How many answered? How many actually got engaged? And what was the attrition rate, et cetera?
It's a huge, as you say, it's a huge problem, not just an issue. It's a huge problem for everybody. I should have looked back at our results from the last study. As I indicated, we got significant results based on everybody who had initially signed up. So there evidently was enough participation. But clearly attrition is a big problem. I haven't looked at our current, we started the UC Alive program in October, and so I haven't yet looked at issues about attrition. I'm sure there is attrition. I know there is attrition. People get tired of emails. That's a problem. Another problem that we hadn't really thought much about is people retiring and changing their emails and so on. But so why might attrition be less of a problem? Partly, it comes every week. It reminds them every week, this is a program you're working on. In the email that comes, it actually reminds them what they said, why they said they were doing this. Because we asked them at baseline, why are you doing this? And the answers are, because my doctor told me to, or to be a good example for my family, or so I can be healthy in retirement. So we remind them in the weekly email. That's one thing. There's a mid 12-week email which specifically focuses on dropouts and says everybody drops out, everybody falls off the wagon, here's an opportunity to get started again. So I can't give you any more detail about that. It is a problem, and if you have any suggestions about doing anything about that, I would certainly welcome it.
Great. Do we have other questions for Dr. Block?
I was just wondering whether or not you thought of doing physiological tests at the beginning and at the end, because I know that there might be a problem with people lying or feeling like they should commit to the goals that they set.
Yeah, absolutely. Physiological tests are, we would love to do that. In fact, if we do in fact get this prediabetes grant, we will obviously do physiologic tests before and after, because it's reasonable to say, well, okay, so they reported being more physically active. A, do I believe that? And B, does it have any reflection on their physical situation? We've just never been in a situation where the grant was big enough to do that. But we hope to do it in the future.
Other
We
questions?
actually do have, we have a study that's just getting started actually in university students, because there's the freshman 15, and we will be doing a number of physiologic measurements there, BOD-POD and beta-carotene and HDL and things like that. So we're hopeful.
So I was wondering, in a program that's designed around email and very interactive, what was the rationale behind putting printed materials in there?
Because although information doesn't change behavior by itself, it can support behavior change. I mean, for one thing, no, maybe I'm misunderstanding. Did you say what's the point of printed materials? Yeah, the printed materials, what we've just added. Well, we actually think the printed materials are important because, if nothing else, it's something that comes physically in the mail, and it says, oh yeah, that's right, I'm part of this program. If nothing else, it reminds them that they're part of this program. Maybe it gets them thinking about, the issues that they are supposed to be working on. So although the printed materials are kind of a pain in the neck, actually, we feel it's important to keep up engagement.
Other questions? Dr. Block, thank you so much for taking the time with us today.
Thank you very much.
And
it's been a pleasure.